UCF 4 for 6 on third down. Milton sprinting out. Ooh, he's cut down at the 25.
McKenzie Milton, dislocations are bad. So vessel restored, then you address, hopefully the nerve function comes back, stabilization of the ligament, so then you get to reconstruction. So he probably has to go through PCL reconstruction, ACL reconstruction, posterolateral corner, anteromedial, medial collateral, lateral collateral. There's a lot of different reconstructive options he may have to go through. So this won't be good for their playoff chances, will it? Oh! Ouch! Let's talk knee dislocations. This is not something you want to have on a football field. McKenzie Milton, UCSF, starting quarterback. This totally affects a game. And McKenzie, my heart goes out to you. Brutal injury. Let's talk about it. Here we go. So what is a knee dislocation? You've seen my knee model before, correct? So within the knee, fibula, tibia, femur. You have the patella, patellar tendon all in the front. You have the tissues, meniscus, ligaments there. Ligaments cruciate inside. Okay, that's all the knee. Well, no, it's not. Muscle, soft tissue around, but in the back, popliteal artery, tibial nerve, common peroneal nerve, popliteal artery. When you have a dislocation, you are putting so much pressure on that artery and nerve that you can tear it, you can injure it, you can bruise it, you can stretch it, or you can rupture it. Now, nerves usually get stretched pretty badly. And even if the nerve looks grossly intact, which means that just macroscopically with the visual of your eyeballs that you look at a nerve and it's not torn, inside you have microscopic features of the nerves, these tiny little microfibers or axons that can get torn and disrupted. Most prone to an injury directly in the back is the popliteal artery and the tibial nerve. If it dislocates back, there's pressure and risk of injury or tearing of the vessels and nerves, even if it goes out the front. And so the challenge, of course, is did he land in a flex knee and dislocate like that? Did he land extended, hyperextended, and dislocate like that? The easy part of all that is just reducing the knee. All the ligaments are torn. Everything is torn. Not necessarily the entire patellar mechanism, but it could be. But you've got often at least one or two collaterals, usually both cruciates, and several other minor accessory ligaments of the knee, including the capsule, oftentimes associated with meniscal tears inside the knee as well. Sometimes you can have associated fractures. In the grand scheme of things, it's not the worst knee injury, but it is a pretty catastrophic football sport knee dislocation injury. So what is the recovery of all this? Now, the ligaments in this particular case take a second stage. The primary focus is going to be restoring blood supply, because no matter what you do, even if the nerves are intact, if you don't have blood to a leg, you lose it. So you need to restore the blood supply, and that may involve just lining it up, recannulizing the artery, or sometimes grafting it if needed. You restore it. Now, once you restore the blood supply, it needs to be stabilized, because if you do a graft or if you have to restore it, you don't want movement, because then it could clot. So you do not want that to happen. And therefore, oftentimes these patients with a knee dislocation will be put on an external fixator or some type of stable fixation to prevent motion of the knee, as well as keep all the ligaments close enough to each other so late reconstruction can be performed relatively easier. Now, this is not an easy injury to deal with. So, nerve injury, what can happen? Now, in McKenzie's case, We heard that it's a significant injury, that it was significantly bruised or stretched, but not completely torn. The grade of injury of the nerve is not known, but it sounds like he has some nerve damage. That can take a while to recover. Now, nerves can typically recover, the rule of thumb being a millimeter a day, just based on data on transection of nerves, but he didn't have a transection. But even then, even if the axons within the nerves had to almost reconnect themselves down, you often have a millimeter per day of travel for everything to rehab and recover. So that can take a long time. So you have the vessel, you have the nerve, and luckily it's not transected, so he has hopefully some function and maybe hopefully regain more function. We have no idea whether he's going to regain full function as of yet, because it takes some time and it's a long rehab recovery. So vessel restored, then you address, hopefully the nerve function comes back, stabilization of the ligaments, so then you get to reconstruction. So he probably has to go through PCL reconstruction, ACL reconstruction, posterolateral corner, anteromedial, medial collateral, lateral collateral. There's a lot of different reconstructive options he may have to go through and work through so that he can get to a point where he can start moving the knee and rehabilitating it. So he's going to go through stiffness, pain, motion, strength loss, atrophy, and then have to regain all that. So not only does he need to relearn how to move his leg, he needs to relearn how to walk, balance, run, and pivot. All of those things can take a very long time. Yes, he's out for the season. Is he going to go back to football? We don't know. I am hopeful. Here's hoping for you, McKenzie. Recover well.